Hi, I'm John Neuro, and I'll be performing the upper musculoskeletal exam, and I'll also be including the motor and the sensory and the reflexes in this part of the examination. This is my model for today, Amy Anderton, and we're going to go ahead and get started with this examination. I have already washed my hands before I came in, and the first thing I'm going to do when I come in is I'm going to check my patient, see that she is, take just a general assessment of her. She's sitting upright, she's aware, she's alert. Okay, everything looks good. And we're going to be starting the upper musculoskeletal motor examination, and I want to demonstrate a couple things before we get started with that, the terminology you might see. So go ahead and stand over here, please. First off, when we're looking at the movements of the musculoskeletal, we're not interested in the musculoskeletal aspect, we're not interested in strength. We're interested to see that the joints are moving freely and loosely, and they can go through what's called a complete range of motion. We can check out the range of motion. We can look at ourselves and see how much range of motion we have, and we can also measure the degrees of range of motion. So let's say, for instance, I want to measure the degrees of range of motion with Amy and just use her shoulders for an example. Just an example. I want to check her flexion, okay, so forward flexion with her arm. She's standing in an anatomically neutral position, so I'm going to have her bring her arm up by herself as far as it can go. This is called active range of motion, where the patient's actually doing the range of motion. If I were doing passive range of motion, then what I would do is I would take my hands and move it and just check to see if she has any discomfort or it gets to a point where it hurts. And if she had maybe a shoulder tenderness or a pain or a dislocated shoulder, it might start to hurt around here. But her range of motion right now for active and passive is pretty fluid, okay? We can also check out the degrees of range of motion. And when you check out the degrees of range of motion, you're just basically imagining just a compass sitting here, something we can measure degrees with, and just having her go through the degrees of range of motion actively. So go ahead and flex your arm up as far as you can. This would be 90 degrees, about 180 degrees, maybe a little bit further, maybe about 190 degrees total. Bring it back down, that's flexion. When we have her extend, she extends her arm back behind the body right here, and extension looks to be about maybe 45 degrees or so, okay? Good. We want to check out also, let's check out and see the degrees of range of motion for her abduction. So she's going to take her arm this way and go up as far as she can, up over her head, so that's about 180 degrees once again for abduction. And then when we have her adduct, she's going to bring her arms across her body this way, and that looks to me to be about a little under 90 degrees, maybe about 80 degrees of adduction, okay? The next range of motion we're going to look at is internal and external rotation. So I'm going to position the arm here and have her internally rotate her arm, and that looks to be about 90 degrees right there, and then have her externally rotate her arm. That's about 90 degrees right there also, maybe a little bit more than 90 degrees. Okay, and that's active range of motion. We're going to be looking at another thing called functional range of motion when we work with her on the table. But that's just what it's called, and that's how you measure the degrees of range of motion, okay? So let's go ahead and start the examination and look at the posterior side of Amy. We want to make sure that we can see all the skin in the area that we're looking at first off, okay? So if the gown were closed like this, I need to open up the gown like that, and I want to be able to see, we're looking at the cervical, thoracic, and lumbar spine. So I want to be able to see all the portions of the spine that I'm interested in, and I can sure see that right down to the edge of the sacrum right here, okay? So I'm going to start by inspection. We always start all our examinations by inspecting first. We're going to look before we touch. So I'm looking down the spine, checking to see if there's any deviations, if there's anything that looks like it's a little out of shape. It looks like there's a slight deviation right here, maybe a little scoliosis. Have you ever had a little scoliosis right in here? Okay, and you can see there's a little bit of a sway in the back right there, but nothing too dramatic, okay? So I've inspected that. While I'm inspecting, it's always a good idea, since this is the first time I've seen this portion of her dermis, to go ahead and look at the skin too. Check and see if there's any blemishes, moles that look uneven, anything that stands out, cuts, abuse, signs of trauma, things of that nature. Everything looks pretty good, okay? So now, the next thing I'm going to do is I'm going to palpate. I'm going to palpate the spine. So I'm going to just go down the vertebrae from right at the top here and put my fingers between each vertebrae and just feel for tenderness, feel for anything that feels out of shape, feel for any herniated discs, things of that nature. I'm just feeling down each one of the vertebrae, putting my finger between intervertebral processes right there, intervertebral processes. So I'm feeling down, and you can definitely feel there's a little deviation in the spine, right in this area right there. If you have Amy for a patient, you can feel a little tiny bit of deviation. You can see my fingers move over to this side, as being right down the center line. So now we're in the lumbar spine right here, and we're going to palpate right down to the sacrum, okay? Does everything feel okay there? Mm-hmm. And you'll notice that it says palpation or percussion, and in this sense, what percussion is I'm just going to go through and just use my fist like this. I'm going to go out to the next layer of muscles and just come down the back like this, hitting against the spine, the two sides of the spine, and I'm just checking to see if there's any tenderness to the patient, if she flinches or if anything hurts on her way down, okay? Everything is just fine. Something we do on the posterior side of the back, since we already had the patient standing up, is we check for what's called costovertebral tenderness. And the costovertebral tenderness is really part of the abdominal examination, but this is a great place to throw this in. So I'm just going to put my hand over her back right here where her kidney would be located, and then striking my own hand right here, see if there's any pain or tenderness associated with her kidney. Once again on this side, striking right there. And she's demonstrated a little pain or tenderness, so we're going to be careful on that side over there. All right, so that takes care of our palpation and our percussion across the spine. The next thing we're going to do is we're going to check for range of motion of the cervical spine, all right? And so anything that's attached to the trunk of the body moves in 6 directions. And in this case, the neck, the cervical spine, will flex, it'll extend, it'll laterally deviate, and it'll also rotate, okay? So I'm going to have her look down, put your chin to your chest as far as you can. And I'm checking just to see if there's even, consistent motion, there's no crepitus, there's nothing else like that, okay? Now go ahead and look up as far as you can, and that's our flexion and extension. Now I want you to put your ear to your shoulder on this side right here. That's our lateral deviation on one side and the other side, good. All right, now I'm gonna isolate her shoulders here and have you look over your shoulder from the neck on one side, good, and look over your shoulder from the neck on the other side. Very good, okay? That takes care of the cervical spine, range of motion, and everything looks like it's normal and healthy. Next thing I'm going to do is I'm going to check the range of motion for the lumbar spine. And it'll be the same directions that we checked for the cervical spine. So I'm going to have her stand away from the table just a little bit. Now go ahead and reach down like you're going to touch your toes, all right? All the way down, then come up slowly. And we're just checking to see that the back moves easily. There's no hitches in her movement or anything like that. Next thing I want to do is I want to have you reach down and pick up a bucket on your left-hand side. So there's our lateral deviation. Okay, go ahead and do the other side. Very good. Now the next thing I want you to do is I want you to twist at your hips like you're looking over your shoulder. Good. Twist at the hips on the other side now. Very good. And that takes care of our range of motion for the cervical, thoracic, and lumbar spine. Go ahead and have a seat. Very good. All right, the next part of the examination is I want to inspect her shoulders, all right? And we always want to make sure that we drape our patients to the level of comfort and always assume the level of comfort is going to be modest in this case. So I just want you to lower your drape down to about to here. Just go ahead and hold on to that right there. And I'm going to start by inspecting. Once again, we always inspect first before we touch. And I want to look at both sides of the shoulders. I want to see that they're sitting even on both sides. I'm noticing there's not any pulls or strains, no bruising, nothing of that sort. And once again, I've got an opportunity to check out some new dermis right here across the top. A little redness right there, I'm not sure what that's due to. And we've got some moles and things that we gotta keep an eye on. All right, so we're inspecting the anterior side, and also, whenever you have an opportunity, when you can see both sides, inspect the posterior side of your shoulders. Keep in mind when you're here doing an examination at the Office of Clinical Skills, especially for test time, that all inspections have to be verbalized. So that's what I'm doing. I'm looking at your shoulders, okay, looking at the front. I'm looking at the back of the shoulders. Everything okay with your shoulders? Mm-hmm. I always like to inquire before I touch. It's not something you have to do, but it's a good idea to see if there's any problems you should know about before you move on and start manipulating or palpating the body. I'm going to palpate this side first, and then we'll palpate that side over there. And these are the different places that I want to make sure I palpate from. I want to go to where the sternum meets the clavicle, and I want to palpate across the clavicle. If she had dislocated or broken her clavicle at some time in the past, you'd be able to feel the deviation of the clavicle. So I'm going to work my way from the sternoclavicular notch right here, work my way across here until I get all the way over to the acromion, the top of the shoulder right there. And then what I want to do is I want to come around the posterior side, feeling across the scapula, the scapular spine, until I get to the other side of the acromion right there. I want to feel the acromioclavicular joint right in here. I want to see if I can feel the coracoid process right over here where the scapula goes under the acromion. I'm going to feel the subacromial bursa right underneath here, where my thumb's at, and we'll catch it from the other angle over there. I'm going to also check and see if I can feel where the humerus goes into the socket right there. And everything feels just fine. So I've palpated one side, now I'm going to palpate the other side. We do it, everything like that. We do it bilateral. We don't go all the way down one side, we go up one side, then we go down the other side. So once again, I'm going to feel across the sternoclavicular, over the clavicle, and you notice I'm pressing in to actually feel the bones. I'm not just dancing my fingers across the skin, but I'm feeling the bones underneath here, sort of manipulating the skeleton underneath there, okay? I'm feeling for swelling, tenderness, looking for any signs of trauma or abuse, okay? Feeling across the acromioclavicular joint right there, coming across the scapula, feeling across the scapular spine, checking for scapular winging as I go across here, feeling for overtension, come across here. I'm going to check the coracoid process where the scapula goes underneath there, and I'm going to feel across the glenohumeral joint right across there. Any pain or tenderness with that? Everything feel okay? Checking the subacromial bursa right underneath here, feeling for any swelling across there and across the front right there. All right, very good. All right, so if you'd like to, go ahead and pull your drape back up again. So now we want to check the range of motion of her shoulders, all right? And we're going to do an active range of motion for her shoulders, and we're going to add a new component to that, what's called functional range of motion. And I'm just checking to see if she has all the range of motion necessary for a normal person to put on their shirt or do anything like that. So put your hands to your sides, all right? And I want you to take your hands, I want you to bring them up over your head like this, all the way up like that. Good. Now bring your hands behind your back this way, okay? Back up again like that. Bring your arms down forward like this. That's checking flexion and extension. Bring behind your back and then bring your arms like that, okay? So that's a functional range of motion or an active range of motion, and we also like to call that getting busted at ECU, okay? So let's go and try that one more time. Arms over your head, ma'am, very good. Put your arms behind your head like this and arms back up again. Bring your arms down and behind and put them behind your back. Everything look like it's moving smoothly, no hitches in there, it's smooth, clean transitions, all right? So we're going to add some components of the neurological examination now. So we're going to check the motor, that is the strength. Okay, so in musculoskeletal, we're only interested in looking at the fluidity of joint movement and even normal tone across the muscles. Now we're going to check to see the strength across this group of muscles we just checked right there. So let's check shoulder strength. Let's have her make some chicken wings like this. And I'm going to go out to the sides here, and it's like, I'm going to just have you resist me pushing down. Very good. Resist this direction here. Very good. She's got equal strength on both sides. Put your arms up like this, like a boxer. So we had chicken wings, we have boxers. Don't let me pull it. Very good. Don't let me push against it. So I check the biceps and triceps. All right. Let's move on to the next section now. So I'm just going logically down the line for the upper extremities. The next thing we're going to look at is we're going to look at the elbows. So if you would please, I want to inspect the elbows. So let's bring those elbows right out here. I'm going to look at both elbows simultaneously. Whenever possible when you're inspecting, try to inspect both sides at the same time, all right? So the elbows look good. Looks like there's a little bruising right there. I'm not sure what happened there, okay? All right, so let's go ahead and palpate the landmarks of the elbow, all right? Major landmarks of the elbow are the medial and lateral epicondyles. Thank you. There was a little pause in there. The medial and lateral epicondyles, I'm palpating across the medial and lateral epicondyles, and the olecranon right across there. Very good. And something to keep in mind, if I wanted to do, if there was some pain or tenderness with a certain joint in your body, I might want to check first active and then check passive range of motion and just feel the joint, okay, as I'm moving it back and forth across there. But for right now, I'm just going to palpate across the joint this side, and then I'm going to come over to this side, palpate the landmarks, the medial and lateral epicondyles, the olecranon, feeling for all the connectivity between those things. And let's go ahead and check range of motion. And for the elbows only move, they only flex and extend. So let's put our elbows up, let's bring them up this way and bring them back down that way. Flexion, extension of the elbows. And you can see if we were just checking the range of motion for the elbows, if this is 0 degrees right there and she brings it as far as you can, that would be 90 degrees, and then we go keep going. And that would be what looks to be about 110 degrees of flexion, okay? And we come back out that way, we extend outwards. Some people can hyperextend their elbows, and that's okay. You don't have to always check for that. But you might see where the elbow dips down across the range right there, so we can hyperextension. All right, that takes care of our elbows. So now we're going to go down to the next joint line. The next joint line would be the wrists, all right? And we also get a chance here to check the epidermis. We see there's a little bit of freckling right in there. You've got some moles and stuff. Let's go ahead and check the wrists, all right? So I'm going to look at the wrists. Inspecting the landmarks of the wrist, okay? The carpals, coming over this way, checking the landmarks on the wrist on that side. So now I'm going to palpate the wrist. Any pain or tenderness I should know about in your wrist? Okay, I'm going to feel across where the radial and the ulnar meet the carpals. I'm just palpating with my fingers in that one region right there, coming across, feeling across this area right there. No pain or tenderness with that. If you were checking for carpal tunnel syndrome, this would be a good time to check right there. Once again, across this right here, where the radius and the ulnar meet the carpals. Feeling across there, everything feels just fine, no problems with that. Let's go ahead and check the range of motion for the wrist now, okay? The wrists move in a couple different directions. They flex and they extend, very good. And they also radial and ulnar deviate. So I'm gonna hold her hands down like this, hold them in position, hold them steady, and I want you to bring your hands in, back and forth like this, okay? Radial and ulnar deviation. And I'm isolating the wrists so that she doesn't take her arm and move her arm like this, that we only just get a chance to look at the wrist movement. Both are moving simultaneously about the same amount, and that looks just fine, okay? Now we've finished the wrist, let's go ahead and take a look at the hands It seems a little redundant, but I like to focus on each section one at a time, all right? Looking at the dermis of the hands, checking out to see that everything looks good, there's no trauma to the fingers, fingernails look good, all that kind of stuff. And I'm going to start off where I left off at, okay? So I'm going to go down to metatarsals, okay? No, carpals, I was right the first time, metacarpals. Feel across the metacarpals, both sides, just checking to see. And then I want to make sure I can check 90% of the DIPs and PIPs, the distal interphalangeal joints and the proximal interphalangeal joints. So I'm feeling on both sides of the joints, checking for pain or tenderness, coming across, feeling both sides of the joints as I go across here, taking my time, feeling for any arthritis, any broken bones, things of that nature, okay? That feels just fine. Once again, coming over here, feeling across the metacarpals, coming across the thumb here, feeling the DIPs and PIPs, both sides, checking to see if there's any pain or tenderness across the fingers, okay? Everything looks good. Now I'm going to check the range of motion for the hands. So remember, range of motion is not strength yet. We're going to check the motor in just a minute, but we're going to check the range of motion for the hands. So if you would, please put your hands up like this. And what I want you to do is I want you to roll your fingers down, flex them down like this, all the way down like that. Now I want you to take your thumbs and go across your hand. So I'm checking the thumb opposition like that, okay? And I want you to bring your fingers up like that. Now spread your hands across like this, bring it back down again. So we check abduction and adduction. Put your hand down flat like this, and we're gonna check hyperextension across the fingers. So hyperextend your fingers up in that direction right there, okay? Once again, hyperextend your hand like that. And that takes care of the range of motion for our hands. It was all done actively. She did all that range of motion actively. So now I'm gonna go through and check the motor, okay? So we're gonna check the motor from here on down, and this time motor's measuring strength. So I wanna see if she has equal strength on both sides, and she's going against resistance, not just against gravity, but against resistance. So put your hands like this, and I want you to roll your hands up like this. Good. I want you to roll your hands down like that, so I'm checking the wrists. I like to call that the motorcycle rider up, motorcycle rider down. Very good. Okay, now spread your hands across like this. I'm going to just check the strength across the fingers here, across the hands here. Very good. Now I want you to grab my fingers, squeeze them tight. So I'm checking the strength of her grip right there. And then I want you to put your fingers like this, okay? I'm checking the strength of the opposition like that on both sides, all right? And that takes care of our motor aspect of the distal extremities on the upper, okay? Now the next thing I'm gonna do is we're gonna add a little bit more to our examination now. We're gonna do some more neuro stuff, and I'm gonna check the sensory, all right? And for the sensory, there's a couple different things we're gonna check. First off, let's take a look at vibratory position sense, all right? Quantitative vibratory analysis versus position sense. Either one is perfectly acceptable to do. So in quantitative vibratory analysis, what I'm checking for is seeing if she can detect the vibration from the tuning fork across the bony structure of her hand, and then if she can detect when the vibration reduces down to 0. I'm going to test it against, I'm going to be able to check against what she feels by putting my finger across the other side of a bony appendage. This time I'm going to use the joint of the thumb, okay? I'm going to use this big tuning fork right here, strike it like this. So the way you use a tuning fork is you hold a tuning fork by the base, not like this, but you hold it by the base like this. You strike it and you can feel it vibrating. We're going to take that vibrating tuning fork and we're going to put it across her thumb right there. And I'm going to just inquire, can you feel that vibrating right there? So if she's feeling it vibrating, I can feel it vibrate through my hand right here. I want you to tell me when the vibration stops, okay? And these things will vibrate for a while. They're a sensitive test. And I'm feeling it slow down.
I don't feel it anymore.
And I stop feeling it about the same time. So if your patient were to feel the vibration stop way before you do, you might be, suspicious of them not having a fairly good sense of vibratory sense. That's vibratory sensory analysis, and I would do it bilaterally across here. You could do it across the wrist, across the finger joints like that. I'm going to do the other test that we can do for this same thing, and that's called position sense. And that position sense, what I'm going to do is I'm going to carefully hold the sides of the joint like this, okay? I'm going to check and see if she can detect if her thumb is going up or down in space. So I want you to close your eyes so you don't see it happening, and I'm going to give her a little sample. This will be up, and this will be down. Okay, can you tell the difference there?
Yes.
All right, good. Now I'm going to move this. I'm going to move your thumb, and I want you to tell me whether or not I'm moving it up or moving your thumb down. Okay?
Down.
Okay.
Up.
All right.
Down.
Very good. Let's do the same thing on this thumb right here. This will be up. That'll be down. Okay. All right. I'm going to hold it like this. Now, which direction am I moving it?
Up.
Uh huh.
Down.
Uh huh.
Up.
And you see I want to be very specific that I only hold the thumb at the side of the finger like that, okay? If she had really long fingernails, I could put my finger against the end of the fingernail here, but I don't want to push my fingers against the pad of her finger because that would be another sense that she's getting through her hand. I just want her to be able to locate or determine if I'm moving it up or down just by moving across the joint right there. So I isolate the joint, feel on the sides, and just move it up and down very carefully like that, okay? That's position sense for the upper extremity right there. There is another test for position sense in the upper extremity that we'll look into when we do the complete neurological examination, and that would be the fingers, nose, eyes closed test, but we're not worried about that right now. All right, so that takes care of our position sense or quantitative vibratory analysis. We've taken care of our motor on the upper extremities. The last thing we want to do is take care of our sensory, all right? So I'm going to go through with a couple of different devices right here. I've got a paper clip with one end pulled out right there, and this is going to be my sharp side, and I'm using a cotton ball right here for my soft or dull side, okay? And what I'm going to do is I'm just going to check and see if she can tell the difference between the sharp and the soft first before I perform the test. So close your eyes, okay? This is going to be sharp. Can you feel that? Okay. Can you tell the difference between that and this? This is soft right there, all right? So I'm going to check her hand to see if she can tell the difference between sharp and soft, and I want to make sure I do it in the same location, the same dermatomes on each side. And we know the hand is split in half right there by a couple different nerves. So I'm going to come over here and I'll say, can you tell me this is soft or sharp?
Sharp.
Okay. Soft or sharp?
Soft.
Sharp or soft?
Sharp.
And that?
Soft.
And what is this?
Sharp.
What's this?
Sharp.
How about this?
Soft.
And this?
Soft.
So let's go ahead and check some other places on our arms now. I'm going to go over to the wrist. Can you tell me what that is?
Sharp.
And what's this?
Soft.
What's this?
Sharp.
And this?
Soft.
All right. What's this?
Sharp.
And this?
Soft.
What's this?
Sharp.
And this?
Soft.
And we'll do a couple locations like that. We want to do the wrists, the elbows, and a couple times across the hands for that sensory, all right? All right, the last thing I'm going to do on this examination is I'm going to check her reflexes. Okay, so we'll take out our handy reflex hammer right here. And we're going to check 3 reflexes across the upper extremities. We're going to check out the brachioradialis, the biceps, and the triceps, all right? So on the brachioradialis, I'll rest my fingers on about the 1/3 part of her hand right here and have her rotate her thumb so I can feel the tendon rolling underneath my thumb right here. So go ahead and relax. And I'm going to put my knuckle, so the edge of my knuckle is right over that tendon, and I'm going to strike the top of my knuckle, so that I'm not striking my patient. I'm going to use the sharp end. I'm going to check and see if she has a reflex. Right there. If you look at her hand carefully, you'll see that her hand moves right there, okay? Very good. I'm going to check on this side. So we do it bilaterally. We check the reflexes bilaterally the same way we check everything else, okay? So, and there we go. We had a little finger flinch right there. I'm going to check the biceps reflex. I want her to make a little muscle for me. Very good. Relax. And I'm going to put my knuckle, once again, the edge, the middle of my knuckle, right on that biceps tendon. Have her relax. Look over there. Think about the beach. And I can feel the tendon underneath my hand contracting as I hit it. Right? Once again, we'll do on this side over here. Find that biceps tendon. Go ahead and make a muscle. Relax. Good. I'm going to strike my finger here. And very good. I can see movement, and I can also feel the tendon underneath my arm. Last thing I'm going to do is I'm going to check the triceps reflex. Have her put her arm like this and relax it into your arm like a cup, okay? So I'm holding my arm, my hand like this, like a cup. She's relaxing across here. You can find that tendon. You can stretch your arm out. Go ahead and raise your arm out and back in again. I can feel that tendon right there, okay? I'm going to hit it with the pointy end, all right? I'm going to check and see if I can see the arm moving, and there it is right there. Good, okay? That's one side, and our reflexes are just fine. Relax the hand, okay, very good. And once again, pull your arm out so you can feel that, very good, relax. And I'm gonna strike it right there, very good. Good, good, excellent. So a couple things that she'll be looking for at the same time if I were doing an examination right now is she'd look and see if I was using regular medical terminology, if I was using too much medical terminology. When you're here for an exam and when you're here for test days, just go ahead and use common terminology when you're working with your patient, okay? So if you say, I'm looking at your shoulders, I'm going to palpate your shoulders, I'm just going to give you a little pinprick here. When we're working on teaching you guys, or we're in the room during a teaching environment, we'll use more anatomical terms. She's also checking to see if I'm just using good behavior, if I'm well dressed, kept myself groomed, right? If she feels comfortable with the examination, if I haven't in some way offended her boundaries, if I'm keeping her modest and draped and all that kind of stuff. So those are a couple of things we're looking for to do the examination. All right, I can't think of anything else right offhand, so.